So for today, we have 47 new cases identified in British Columbia, including one epidemiologically linked case, bringing our total number of people with COVID-19 in BC to 3,881. That includes 1,143 people in Vancouver Coastal Health, 2,045 people in the Fraser Health Region, 146 people who live on the Vancouver Island Health Region, 385 people in Interior Health, 93 people in Northern Health, and 69 who reside outside of Canada. We now have 371 active cases in the province, of whom 11 people are in hospital, 5 of whom are in critical care or ICU. We have no new deaths to report today, and we now have 3,315 people who have recovered. As well, we are following over 1,518 people in all health authorities in BC. So those are people who have had close contact with somebody who's tested positive for COVID-19 and are in isolation and being monitored by public health. We have 2 new healthcare outbreaks in the Vancouver Coastal Health Region. One of them is at the Richmond Lions Manor Long-Term Care Facility, and the other at the Joseph and Rosalie Siegel Family Health Center. Both of these are identified a single case in a healthcare worker, but as you know, even a single case we treat very seriously in our healthcare system, and Vancouver Coastal outbreak teams are on site to help investigate and follow up on those cases. That leaves us with 5 active outbreaks now in our healthcare system, 4 of which are in long-term care or assisted living, and 1 now in acute care. We have 666 cases in those outbreaks, 404 residents and 262 staff. We have no new community outbreaks. However, there have been a number of exposure events, and there's also been a number of cases identified on a U.S. registered marine vessel. And we know that they have been tested over the last couple of days, and there have been a number of the 10 crew members who have tested positive. The Public Health Agency and Transport Canada are managing this, along with our local public health and Fraser Health, as well as the BC CDC, and anyone who has been positive is in quarantine, is being monitored, and all of the contacts are being followed up. There was also a community exposure event that Vancouver Coastal Health has posted at Lions Bay Beach Park in Vancouver Coastal. Anybody who was at the park over the week of July 26th, 27th to 31st is asked to limit your time with others. Monitor yourself carefully for symptoms and contact 811 immediately to get testing if you have any symptoms. The challenges we have all faced as a result of COVID-19 are daunting. And I know for many of us, they are a cause for fear and for anxiety. We know this virus is going to be in our communities for many months to come, and we have adapted our activities. We've done what we can to minimize transmission. We've started to see some increase in cases, but we have put layers of protection in place. We have safely restarted our province in a slow and thoughtful and measured way. We have changed how we work, how we shop. Soon we'll change how our children return to in-class learning, again, based on things that we learned over the past few months. We have shown in British Columbia that we know the precautions we need to take to keep ourselves, our children, our families, and our communities safe. We've shown this. We know that these things work. This is evidenced by the thousands of businesses that have developed their COVID-19 safety plans, as they're required to do, that have reopened and safely increased their interactions with employees and with customers around the province. And yes, we have had some incidences where we've had transmission in these businesses, and we've managed that. When we find people early and we can find their contacts, we can stop those chains of transmission. We know how to do this. We have done it across the province. We've seen this in healthcare, we've seen it in restaurants, we've seen it in some of the events and parties that we've had. We've also seen it in childcare, and we've seen it in how we opened our in-class schools to some children this past June. When faced with setbacks or when faced with clusters and transmission events, we regroup. We come together, we learn, and we've adapted our approach. We've also seen the importance of the contact tracing and the case management and the follow-up that we do in public health to make sure that we can stop those chains of transmission. We keep moving forward with the full resources and support of our public health teams across the province. And we have kept and continue to keep our community transmission in BC low. That is incredibly important, even with the numbers that we have seen in the last week. Obviously, they're higher than I would like to see, but we know where these are happening. We know where these transmission events are happening. And overall, the transmission that we have seen across BC is low, and that's because of all of the measures we have taken collectively. I know for many parents, they are understandably concerned about the impact that's going to happen when their children go back to school in a few weeks. I know also that getting children back into the classroom is essential. It's essential for their emotional and social growth and well-being, as well as for their educational needs, and needs that will keep them as part of the importance that we have in supporting our young people for the next generation. The costs of keeping our schools closed is too high, but we need to understand that all that we are doing to keep our low community transmission enables us to make sure that we can open our schools safely. Like we have done in many locations in many settings, we will be taking many measures to ensure that we reduce risk of transmission in our school settings. We need to look at this as we have every other setting, in every other sector. We know what we need to do. We know those layers of protection will help us. And we need to work together, all of us now, with our schools, our parents and families, our teachers, our school boards, our vice principals and principals, and public health will be here to support you. Opening means increasing interactions. We know that. But we also know that that's backstopped by doing it by layers of protection. And those layers of protection are what we're building into our plans for going back to school. The other thing we need to do is start preparing our own families, our own children now. Use our summer to ensure that we know some of those measures. We know that many children are doing this already. They understand what a safe distance. We also need to practice to ensure that we're getting comfortable with wearing masks in those situations where we need that extra layer. So things like on transit, on our school buses, when we're going back and forth to summer camp. Those are things that we need to start doing collectively now. Out of fear and concern, it can be tempting to shut our doors or turn our backs on each other. But that's not what we have been doing in BC. This is, once again, our time to show kindness and compassion, to be there for each other through these challenging days, these days that are lasting far longer than many of us wanted. Many of us wanted. There are over 1,500 people in BC right now, across the province, who are self-isolating and under active public health monitoring. If somebody you know is self-isolating or from a community where there are a number of cases and where we have outbreaks, and we know that's happening in many places, this is our time to offer them support, not to shun them, not to be afraid, but to make sure they get the help and the services and the care that they need. This virus does not discriminate. We are all being affected by it, all of us, both here in BC, in Canada, and around the world. And we need to come together. No community is immune. We know that COVID-19 is going to be with us for some time to come. And while it remains in BC, we need to keep our transmission low and slow. We need to continue to play safe and stay safe this summer, and to prepare for managing in the weeks and months ahead. Let's also continue to support each other with compassion and understanding. As we look to the fall, let's use the fortitude, the resilience that everybody in BC has shown so far to continue to move forward safely. I know we will get through this together. So let's all continue to be kind, to be calm, and to be safe.